Addiction is an illness, and it's something we can beat. If we give people the tools and support they need to overcome this disease, and if we choose to free people from the stigma of addiction and recognize this as the public health challenge it truly is, we can help people to reclaim their lives.
Governor Christie has really demonstrated a strong commitment to substance use treatment services. He's gone out to actually meet with individuals who have a substance use disorder, has met with families, has met with treatment providers to get a greater understanding of the disease and how it impacts individuals. Even though individuals may know at the time that, the choices may not necessarily be the best for them, it is a disease and it should be treated as such.
Addiction is a chronic relapsing disease which is characterized by compulsive behaviors and the inability to stop using substances, whether it be alcohol or other drugs.
Once a person starts taking a drug for a period of time, changes in the brain occur that have a significant effect on learning and memory and on really the reward system that really controls our behaviors. And so they start not only craving drugs, but they have an inability to control the cravings and the behaviors associated with those, and they seek drug seeking. And this leads to a chronic pattern, a relapsing pattern of drug use. Right now, we have a spectrum of treatments that are scientifically proven to be effective. These range from outpatient treatments, seeing an individual counselor or going to an outpatient program one or more times a week, to a residential treatment program or an inpatient program for individuals with more severe substance use. And there are also a variety of supports or recovery services for individuals to keep them in a recovery state after they've been in treatment and either are drug-free or are in some maintenance type treatment.
When I first got into the field about 30 years ago, there was always an ongoing discussion, a battle about which came first, the chicken or the egg. Was a person depressed and they used drugs? Were they anxious and they used drugs? Or did they use drugs and become depressed? And what we have found over the years that these can be two independent disorders.
Often there are issues such as anxiety or depression, and these often occur because the person is really living a lifestyle and dealing with issues that are very hard for them if they are someone who has a pattern of chronic drug use. They're going to have problems in their family, with their job. They're going to have all kinds of issues that are going to cause anxiety or depression. And therefore, to recover, you need to treat both.
Before we had medication-assisted therapies, everyone thought that our field was just talk therapy. And in fact, some even called us voodoo medicine. But with the advent of the PET scan, which helps locate different chemicals in the brain, the work through the NIH, we were able to determine that addiction is a brain disease. And as such, that puts us more into the mainstream with other chronic medical illnesses.
As we know and as evidence shows, there are different formulations of medications such as methadone, buprenorphine. Buprenorphine is also known as Suboxone or Subutex. And then there's naltrexone, which is known as Vivitrol in its injectable form.
So it's only with ongoing treatment, and very often, medication-assisted treatment is an important part of that, and the recovery supports that people can really have a good prognosis and recover from drug use.
The governor announced that we would have a one-stop center known as the Interim Managing Entity, or the IME, so that individuals would not have to call around from place to place to place to try to find services that they needed. Rather, they could call one number. That number is 1-844-276-2626. 2777. The number is operational 24 hours a day, 7 days a week, including holidays and weekends. The IME is really designed to serve individuals who are low income, individuals who don't have insurance at all, and individuals who have Medicaid. For those individuals who have private insurance, if they happen to call the IME will help them to negotiate accessing services using their primary insurance carrier. So I think the governor really wants to see that individuals who are impacted, both directly and indirectly, have the supports and the services and the resources that they need.
This is the best way to ensure that beyond the statistics, that they become hopeful again, optimistic again, happy again, and productive members of our society.